The day that excessive exercise caused pulmonary embolism. Thank you for allowing us to present an interesting case of pulmonary thromboembolism caused by upper extremity deep vein thrombosis caused by Paget-Schroeder syndrome. We present a 26-year-old male farmer who came to our ER complaining of severe throbbing right arm pain and edema for a week. The pain worsened on abduction and extension above 90 degrees and seemed to improve with rest. He also reported weakness of his right upper extremity but denied any sensory symptoms. On physical exam, vitals were unremarkable. He had 1 plus pitting edema of right upper extremity and had 2 plus peripheral pulses in bilateral upper and lower extremities. The pain was reproducible on passive palpation, and the rest of the exam was unremarkable. Venous Dopplers of the right upper extremity showed acute occlusive deep vein thrombosis in the right subclavian, axillary, and brachial veins. CTA of the chest showed thrombus in the segmental vessels in the right lower lobe as well as in the right upper lobe of the pulmonary arteries. CTA of the upper extremity showed focal concentric narrowing of the right subclavian artery at the junction of the right clavicle and right first rib, which was highly suspicious for thoracic outlet syndrome. The patient was started on a heparin drip and vascular surgery were consulted who planned for thrombolysis. A pre-procedure venogram confirmed the occlusion and patient underwent thrombolysis using an ECOS system. An ECOS system delivers catheter-directed fibrinolytics using high-frequency and low-energy ultrasound. This allows for better penetration of the drug deeper into the clot. A balloon angioplasty was also performed. The post-thrombolysis venogram demonstrated patency of the veins with minimal residual thrombus. Patient was then transitioned to Xarelto with plans for first rib resection and splenectomy in a delayed fashion as an outpatient. To complete the workup, protein C, protein S, antithrombin 3 antigen, and factor V Leiden were all ordered, which came back unremarkable, and there were plans to repeat this as an outpatient. Paget-Schroeder syndrome, which is also known as venous thoracic outlet syndrome, is a rare but important cause of primary deep vein thrombosis in the upper extremities. It's defined as an acute thrombosis of the axillary subclavian vein caused by compression of the narrow costoclavicular space in the thoracic outlet from repetitive strenuous activity, causing post-traumatic inflammation in the veins, resulting in blood flow stasis and ultimately thrombosis. It's also known as effort thrombosis because it typically occurs following vigorous upper extremity activity. Pulmonary embolism is potentially the most serious complication and has been reported in up to 10% of presentations. It's important to identify Paget-Schroeder syndrome as a cause of upper extremity deep vein thrombosis because of its aggressive treatment approach that not only includes anticoagulation and catheter-directed thrombolysis, but also includes thoracic outlet decompression with rib resection and splenectomy to prevent recurrent thromboembolism. Increasing awareness will ensure early recognition and proper treatment. Thank you very much for your time.